very much for inviting me. And hello, everybody. I can't see you, but I know I probably met some of you at the family's the summit in Sacramento a couple months ago. So Tara invited me to talk about what's in front of our state legislature right now in terms of both the bills, the legislation, and also the budget proposals that would affect children and youth with special health care needs. Let me first just describe Health Access. We're a statewide nonprofit consumer advocacy coalition. So we're sort of like Consumers Union, but specifically on healthcare. And our mission is access to quality, affordable, secure healthcare for all Californians. We've been around for about 25 years, and we work with, and our board represents, the children's groups, senior groups, people with disabilities, women's groups, working families, the faith community, the whole broad spectrum of anybody in California who uses healthcare, needs healthcare, whether insured or uninsured. And part of what we do, what we're funded to do, we're mostly funded by foundations, although we also have some membership contributions, is we do policy research, analysis, and development, and we do trainings like this, and we do grassroots organizing, and we do direct lobbying, and we work with other nonprofits and grassroots groups to support advocacy on behalf of other healthcare consumers. So working with Family Voices is a very natural fit for us and a great opportunity. So where we're at now is we just had national health reform pass, the Patient Protection and what is the CA? Well, it's the Patient Protection and Affordability Act, the National Health Reform Law. And basically what it's going to do is expand opportunities for affordable coverage phased in from this year through 2014. Some stuff comes in very quickly this year. Some stuff has already happened, and some things are being implemented in the next couple of years. So significantly, young children can stay on their parents' health insurance coverage now up to age 26, whether they're students, whether you declare them as dependents on your income tax, whether they live with you, whether they're in state or not. That will be effective on September 23rd. The second thing that is directly relevant for many of the families and Family Voices is the insurance companies can no longer deny children for quote-unquote pre-existing conditions. And that is effective immediately. Adults that can't deny starting in 2014, and there will be a temporary high-risk pool for adults until then. But the no denials for pre-existing conditions kicks in now. There's also new standards for what has to be covered if somebody sells you health insurance. All of the loopholes and exemptions and gotchas where you find out after you submit a claim that something that you thought was covered isn't, is now going to, a lot of those loopholes are being closed, and primary and preventive care has to be provided without cost sharing and copays. There will be rate review and regulation. There will be a cap on out-of-pocket expenses based on family income, so it's no more than a certain percentage of your income, and a ban on benefit caps, both lifetime and annual, and no more rescissions, meaning they can't cancel your coverage retroactively after you submit a claim by saying, oh, you had a pre-existing condition that you didn't tell us about. In the public coverage sector, there's a very significant expansion of Medi-Cal to non-disabled childless adults up to 133% of the federal poverty level, which is about $14,000 a year for a single person. So what that means is that for the first time, very low-income adults who were not able to qualify as disabled and did not have minor children at home, so for a lot of people, that's young people, their first couple years out of college, will be eligible for Medi-Cal coverage. It funds healthy families through 2015, It does away with the semi-annual reporting that in California was done as a budget cut, but now you have to do the paperwork to reestablish your kid's eligibility every 6 months. National health reform made that illegal, so we're going to go back to annual reporting. It eliminates the asset test for Medi-Cal, so no more, your car is worth more than $2,800, so you're not eligible. It raises the revenues we need to sustain and expand Medicaid and healthy families at the national level, primarily by requiring employers now to either provide coverage or pay, and by taxing the Cadillac plans that say upper income managers at very affluent corporations, large corporations, people who have no copays, no cost sharing, everything's covered, that kind of Cadillac plan will now be taxed as a benefit. And it prevents states from cutting eligibility in these public programs, which is providing very significant help in California. At the same time as we won these very significant steps forward in national reform, our state budget deficit, which is now estimated at about $18 billion, or about a quarter of our annual state budget, means that the governor is once again proposing billions of dollars in cuts to health and human services for the people who need services the most, including sick children, senior citizens, and people with disabilities. In healthy families, he's proposed to raise the monthly premiums of about 75%, from $24 a month per child to $42 a month per child. Proposing to raise the copay for an emergency room visit from $15 to $50. Proposing a new copay for a hospital inpatient care of $100 a day, and eliminating coverage of eyeglasses and other vision care. There's some question about whether these cuts, particularly the increase in premiums, would actually be permitted under the healthcare reform law, because to the extent that causes people to drop out of the program, it would actually be a violation of the maintenance of effort in national reform. But that's what has been proposed. Many of you probably also work within home supportive services and know that he had originally proposed elimination. Now when they revised, what he's proposed is basically unspecified cuts of $750 million, which is about half the state's payment, with this sort of stakeholder process. But the concern is that anytime people say they're going to make $750 million of cuts, and they'll tell you what they are later, in a program like IHSS, that could in fact mean cuts in hours and caretaker pay. For people who have Medi-Cal, these cuts affect only adults. Children under 21 have been exempted from these proposed cuts, but the governor is proposing, again, the new cost sharing, increased cost sharing for Medi-Cal, a limit of doctor and clinic visits to 10 a year, a limit in the number of prescriptions to 6 a month, elimination of over-the-counter drug coverage, and new copays for, I duplicated that, sorry, hospitals, ER visits, and prescriptions. And also, again, this is for adults only, but I think, as we're talking about what is Medi-Cal, what is coverage, what is adequate coverage, I think people who have children on Medi-Cal or healthy families should also be concerned about the precedent this was set. An annual dollar cap on coverage of supplies and durable medical equipment, so that I know people talk about how hard it is already to get an approval for a hearing aid or a wheelchair, and how to to finally get the paperwork done and get a decent piece of equipment. This would now add another barrier and another a limit, an annual dollar limit. And complete elimination of Medi-Cal eligibility for legal immigrants who've been in the U.S. for less than 5 years. The federal government doesn't pay for them, the state does, and this would eliminate the state commitment to providing that. So Health Access has, for many years, organized to expand coverage. We worked very hard on getting the healthcare reform law passed, and we have fought against these kinds of Medi-Cal cuts for the past several years. And we're working with a coalition of other health and human services organizations, consumers, providers, and advocates, and we call ourselves the HHS Network. It's a very loose coalition, but we're saying there are better choices for California, and we're calling that a family recovery budget. In this time where so many people are losing the coverage they have because they're losing their jobs, what we need to do is invest in people so that we're creating jobs. We need to protect the jobs we have. A lot of people work in health and human services. A lot of people can only go to work because of the child care or adult day health care or in-home support that they get for their family members. We need to maintain basic services for families that depend on them. And there is waste in the budget, and the waste is in these about 10 to 14 billion of corporate tax loopholes that California has granted over the past 10, 15 years when we had plenty of money and we were promised that these different kinds of tax breaks would create jobs. But they're not audited. They don't sunset. They never go away. When they are audited, many of them, there's actual proof that they don't create jobs. What they seem to be doing is creating increased dividends for Wall Street shareholders, and that's not an appropriate use of scarce state dollars. Now, if the choice is, raising the cost of families who are already strapped, trying to provide the level of care that sick children need. And what we're seeing is that legislators are responding to our message about California having better choices. In the past couple of weeks, we saw the leaders of the Assembly and the Senate, Perez and Steinberg, and the leaders of the budget committees in the Assembly and Senate, Blumenfield and Ducheney, both introducing counter-proposals on the state budget that protect health and human services, much more in the Assembly side. The Perez proposal would make no cuts to education, health care, or human services. None of the cuts the governor has proposed. And they talk about closing corporate tax loopholes. Again, in the Assembly side, they're talking about raising much more money, $10 billion. But on the Senate side, they're talking about raising $5 billion. The packages are not everything we would want. There are middle-class tax increases, certainly in the Steinberg proposal, things that were done last year that would be extended, like reducing the ability to write off the dependent child tax credit. They will be, hundreds of dollars for an average working family per year. We'd rather see those who are at the highest end of the spectrum pay more, because we think low-income people and working people have already been asked to make the lion's share of the sacrifice in the past several years. But that said, it's an important step forward in terms of reframing the debate, that it's not just about who do we cut, but it's about what is California spending money on that really isn't creating the value that we need at this time. So the other thing in healthcare reform is that California must pass some bills now at the state level to implement the national reforms. Health insurance is regulated by states, not the federal government. And so now that the federal government has passed these laws, there are certain things that we have to do to make it real in California. And again, also the expansion of the public programs. And we can go further. We can move faster and do more to cover more people and provide even better protections for consumers of both public and private health coverage. And we have to pass a balanced state budget. And both of those things have to happen by this summer. Legislation, this is the second year of a 2-year legislative cycle. All of the bills have to pass what's called their second house by August 4th. They have to pass their first House by Friday, and almost all of the bills that we're concerned about passed yesterday, and a couple more still pending. The budget is supposed to be approved by June 15th, but that's not really, it never is. The real issue is that at a certain point, sometime in the summer around August, the state starts running out of money and it starts issuing IOUs and vouchers to employees and contractors. So really the state needs to pass a budget, preferably by the end of July would be much better. So the next 60 days are key for both passing the bills we want and stopping the budget cuts and getting a better budget. So there are basic advocacy things that everybody can and should do. And the very first one is know who your state legislators are. Everybody has 2 state legislators. You have an assembly person and you have a state senator. And their names and their phone numbers and their addresses, you can find them by putting your zip code in at this website, the www.leginfo.ca.gov/yourledge.html, and you'll see a box. Put your zip code in, and it'll just pop right up there who your state senator is and who your assembly person is. And I really recommend, I do it myself, print that out, put it on your fridge. And the second thing is call them not just once, but call them every week. It's the squeaky wheel that gets the grease, and this is a time when everybody who wants a bill passed or wants a budget cut not to be made is calling and calling often, and it is appropriate and effective for you to call every few days, once a week, and you'll get to know the staff in the office, and they'll get to know you, and that's absolutely okay. And the 2 things that you want to do when you talk to your legislator, the secretary or whoever answers the phone, is you want to make sure they understand what you're asking the legislator to do. Don't raise premiums and copays in healthy families. Don't cut IHSS. And then ask them what they're going to do to fix the budget. How is Assemblyman so-and-so, how does he propose to fix California's budget problem? And if they are saying it should be cuts only, then ask them, do you think this program should be cut? And if they say no, ask them where they're going to find that $18 billion. Really, it can't be done with cuts only. There's just not enough, fat left in the system. The next thing we'd love everybody to do is to join a group that's going to do a meeting with your state legislator in their local office. Sorry, let me get this to go away. You don't have to go to Sacramento. Every legislator has 1 or more district offices in the biggest city in their district. So, for example, if you're in Bakersfield, Ashburn has an office in Bakersfield. If you're in Santa Barbara, Nava has an office in Santa Barbara. And they have staff there, and you can make meetings and appointments. And, it's always wonderful if you can meet with a legislator personally, but that often takes a lot of time and a lot of work and a lot of clout. But meeting with their staff is also, it's very instructive. I always like to have somebody look me in the eye when I say, if you raise the premiums and copays in healthy families, it's going to affect CCS, and my family is going to end up spending, $1,200 a year more for my child's health care. I want them to have to look me in the eyes when I tell them that. It's very different than just writing it in an email. And then when I ask them, how does Assemblyman so-and-so think the budget should be balanced, I want them to have to look me in the eyes when they say, Assemblyman so-and-so thinks everybody has to, accept more cuts to children's health care, if that's what they're going to say. It makes a really big difference. Health Access and the HHS Network, we're doing a bunch of visits over the next 2 months in different legislative offices. And so if your group is already doing meetings with your legislator, we would love to have you come with us and with other healthcare advocates and consumers in your area. In some places we work with doctors as part of the National Physicians Alliance. In some places we work with local community clinics. We work with disability groups, we work with senior groups, we work with the child care and CalWorks groups, and these are all folks that you can go with so you're in a group, and it kind of helps. If you've never done this before, it makes it feel much more comfortable, strength in numbers. And it's also very important because it shows them that the community is watching them, paying attention. And then the other thing that you can do that's really easy is, and this might be something Family Voices could do as a group or in any individual organization like a Family Resource Center, we're doing a postcard campaign, and we've got these customizable postcards on the web, and you can print them out 4 to a page on cardstock, and you can just hand them out to every meeting you go to, and you collect them back from people. And they say, gosh, I guess I could even click through and I could show it to you. But it just says, you know, yes, I want you to pass a budget that has, so this would take you to the HHS Network website for tools and resources, and you scroll down here to this 10,000 by May 10th and beyond, and there's this customizable postcard. And customizable, oh, I'm sorry. This is, okay, I don't have the right programming on this, so I'm going to go back to my PowerPoint. But basically, that postcard says, you know, please don't cut these programs, please close corporate tax loopholes instead, I'm counting on you. And then you can like set a goal of collecting 100 in your area, and then you can have 3 people from your local parents group go to the office of your local legislator and deliver them in person. Or you can put them all in an envelope and mail them, however you want to do it. Or you can have a bunch of people go to Sacramento from Family Voices who've collected postcards from everywhere. So we're doing a lot of that kind of thing as part of the HHS network. And we're going to talk more. There's a statewide call next Friday, June 11th at 11:30 a.m., and I think Tara's planning to be on it, and everybody on this call is welcome to be on it. We'll be sending an email out with a call-in number, and that's where we're going to talk about the next 2 months for all of the groups across the state that are part of this HHS network on the budget. What is everybody doing? Are people collecting postcards? Are they doing ledge visits? Are they doing lawn chair vigils at assemblymen's offices? Are they doing bake sales, lemonade stands? How are people getting the word out and trying to change how the legislature votes on the budget? That'll be a good way for you to get good ideas if you're not already doing stuff about things that you could do or plug into locally. And we do have HHS coalitions all around the state that you can plug in with. In the Bay Area, there's a very active coalition that meets once a month, and we're doing a March for Budget Justice on Thursday of this week at 11:30 a.m., meeting at Powell Street Bar, and we're aiming for 500 people. It's going to be really lots of fun. We encourage folks who can to come on down, bring your homemade signs, bring your kids in strollers, bring your, you know, your banners from your organizations. And then I don't know when the next Budget Coalition meeting is, but we'll have a meeting after that action to debrief and figure out next steps. In Santa Barbara, we're not doing an active coalition in Santa Barbara, but we are building a coalition on the Central Coast in San Luis Obispo, and we have a meeting on Thursday, June 10th. And if folks would be interested in coming up, I know there are sometimes folks from Santa Maria who come to SLO. We'd love to have you there. In Los Angeles, there's a March for Budget Justice. on June 15th at a very large Stop the Cuts coalition that meets regularly. You can contact our LA organizer, Nancy Gomez, for more information. In Reading, we don't have an active coalition, but the California Commission on the Status of Women, which is a member of the HHS network, is having a public hearing and talking about how so many of the budget cuts are falling disproportionately on women and girls. And they're very much aware. They're going to talk about CalWORKs. They're going to talk about child care. They're going to talk about in-home support. They're going to talk about Medi-Cal and healthy families. They'll talk about how all these cuts are falling on women throughout their life cycle. And I am willing to bet that the majority of people on this call are women. So it's just another way to slice and dice the issue in another forum. In Fresno, you can call me. There are some local groups working. There's not a lot happening right now, but if you're interested and you're from Fresno, I'd love to talk to you. Similarly, in Bakersfield, we've done an action recently. We're working with the Independent Living Resource Center and some other partners down there. And in San Diego, there's a coalition that just did a march and rally, and Angela Woods is our organizer there. So that concludes the presentation part. I hope that that was helpful, and I'll take questions.
Okay, I have one question typed in, and if other people have questions, please go ahead and raise your hand. We have a lot of time for discussion today, which is great. One question from Joan Crook. Actually, Joan, I'm going to try to open you up so we can hear you, so you can ask your question. Joan, are you there?
Joan. Hello,
Joan?
can you hear me?
Yes, we can.
Okay. Yeah, my question was about the family recovery budget, and I was just wondering who drafted it and if there's someplace we can go to read the details of it.
Yes. So on my website, I'm calling up this website. Can folks see this? That I just called up hhsnetworkca.org.
Uh-huh.
The family recovery budget, I mean, okay, so it's talking points rather than an actual budget. We're an ad hoc coalition of different grassroots groups, so we don't have a full detailed budget. What we have is talking points, basically. What we're saying is what we want the state budget to do this year is we want it to protect jobs, and that's both public and private sector jobs. When you cut Medi-Cal and other low-income programs, especially the programs that bring in federal matching dollars like Medi-Cal and Healthy Families, you're cutting jobs both directly because of the people who work in the programs, but also because low-income people who use the programs spend every dollar they earn in their local community because they don't have any investments or any savings. There's a multiplier effect. So UC Berkeley has done a study. The Families USA has done a study, but the general estimate, we have a paper on our website, but there's estimates of between 330,000 and 430,000 jobs that would be lost in California if all the health and human services cuts proposed by the governor were made, because both the cuts to public sector and private sector service providers where there's jobs being directly cut, but also because of that multiplier effect that families who have to buy medicine then aren't going to buy less local groceries, and so local businesses suffer. So it sucks money out of the local economy. So when we're talking about jobs, we're talking about basically that stimulus effect of public spending and not having it go out of the economy. When we're talking about the safety net, you know, we're saying don't cut vital health and human services. Cut, and we're not saying cut somebody else's programs. We're saying close corporate tax loopholes that if you have, like the enterprise zone tax credits are a really good example. You have 2 state audits showing that they have no impact on job creation, and yet the state is spending hundreds of millions of dollars a year. Or you have the corporate property tax loophole that was in the New York Times recently, where corporations that when they sell property, they don't get reassessed, so they're still paying property tax based on the property tax value from 20 years ago while our schools are suffering. So there are talking points. They're up on this website. If you look at the link that says budget info, let's see. We have, I don't do this website. We have, somewhere on this website, we have a basic statement. I think it's in the about, yes. This forging a vision describes the rationale for each of these positions. They talk about not making cuts, reforming the budget process, and looking at revenue solutions that don't hurt the economic recovery. There is also a document on the Health Access website at health-access.org. Under state budget, we did an analysis of, on the third bullet point down, it says cuts to health care are bad for California's economy. And that's where we talk about the how many dollars health care spending brings in federal dollars, and how many people are employed in health and human services, and what the impact of the cuts to health care specifically would have on the state's employment and economy.
Okay. Am I still on, Tara?
And I'm sorry, so the last thing is the budget proposals that the legislative leadership have introduced, the Assembly and Senate proposals. One of them is on this website, the HHS Network website, under official state budget documents. There's the Assembly jobs budget that Perez has produced as a proposal, and that's on this website. The Steinberg one you have to Google. It's actually not on this website. I'm not sure why. I can talk to the guy who puts stuff up here.
Okay, great. Thanks, Joan. Unless you had a follow-up question?
I just wanted to thank Jessica, and I really like your PowerPoint. And I was wondering if the PowerPoint is going to be available, because I think some of those slides, if someone doesn't want to get into a whole conversation or doesn't have enough time, we can just take those as like 2-minute statements when we're calling a legislative office.
I'm absolutely happy to, I sent this, Tara, you're welcome to send it to anyone who wants it.
Great. Yes, I will be sending it out probably today or tomorrow, Joan, as well as sort of a link to this presentation. Great. Well, thank you. So
there's one thing. I'm sorry. Is there another? There's one thing I forgot to mention about bills that I just wanted to mention.
Yes, go ahead.
So one of the bills is, I think, particularly appropriate for folks who have who are self-employed and are trying to buy coverage for children with so-called pre-existing conditions. So the federal reform says that the insurance companies cannot deny coverage anymore to kids with pre-existing conditions, but it doesn't say that they can't jack up the price. And so, if you have a pre-existing condition, your premiums are very high. And so in California, we're actually moving legislation by Assemblyman Fewer. The bill number is AB 2244, and what it says is, in California, if you have a child that the insurance company says has a pre-existing condition, not only do they have to provide the coverage, but they can't raise the price of the premiums above a certain band, above a certain range, above children who don't have a pre-existing condition. And we're also doing some rate regulation bills. AB 2244 passed the Assembly yesterday. We're very happy about that. It now goes to the Senate. The insurance companies hate it, of course, because it limits their rate increases. So if this affects you, if you have private coverage and a child with a pre-existing condition, we would very much encourage people to call your state senator at some point in the next month and say, please support AB 2244. And there are also bills that we're trying to pass that would regulate rates for everybody, children and adults, and that would create some sunshine on higher rates for people with pre-existing conditions until the 2014 prohibition on pre-existing conditions kicks in. And those bills, we really need your help. We really need calls today and tomorrow to your assembly members. And those bill numbers are AB 2578 by Jones and SB 1163 by Leno. And you can look them up, or I'm happy to describe them if people want more information. But I just wanted to say that for folks who've got private coverage, these are very major steps forward in not lowering, but controlling, reducing the rate at which private insurance rates go up.
So do other folks have questions? You can go ahead and type them in or raise your hand also. And while we're waiting for you to send in your questions, I have one. Could you describe for folks what a group meeting looks like, and could people arrange their own?
Oh, yeah, I'd love to. That's a great idea. So a group meeting, here's how we usually do them. I like to bring in anywhere from 5 to 10 people. Often a legislative office in the district will say, well, we have a very small conference room, so you can only bring 5 people. But I think it's a really good experience to have, and the more people in some ways the better, because anybody who's a constituent of that member has a right. It's the most basic right of representative democracy, is to tell your legislator what you want them to do on your behalf and to hear their answer. So the first step is somebody has to schedule the meeting, and that's, Health Access is always happy to do that. And once we get, the meeting date and time, and the easiest way to do that, anybody can do that, is you simply call the office and you say, I'm a constituent and I'd like to schedule a meeting for myself and, some other people from my Family Resource Center to talk about the budget cuts. And I would like to meet with, the district director. That's a good person to ask for. And excuse me. Pardon me. So once you get your date scheduled and you've got like your 5 people or 10 people rounded up, excuse me, I always do a little pre-meeting. I like to schedule a good hour, and we'll all meet at a coffee shop near the legislator's office, and we'll kind of go around and everybody will say how the budget cuts are personally affecting them or would affect them, because that's really, this is not about being a policy expert. This is about being able to say, I am extremely concerned about the increase in the copays and health premiums for healthy families. It would affect me in the following way. And also giving a little bit of background about who you are. I've lived here for 30 years. I grew up here. I want my kids to grow up here. I feel really invested in this community. I pay taxes. This is not the California that I want to see for me or my kids. If you're on the board, a lot of times we have people who are serving on boards of nonprofits, like you're on the board of your local Family Resource Center, or you're on your PTA, or you volunteer at any local civic organization, or you're like a den mother for the Girl Scouts. I'd say always mention those things in the meeting, because that's how you kind of position who you are in the community and who you're connected to. Legislators care about not just you're a voter, but who do you know and how can you be helpful to me next time I'm running for re-election, right? So when you say I'm on the PTA and I'm a den mother in the Girl Scouts and I'm, active in the local family resource center, that's how you signal to them, I know a lot of people. And so the pre-meeting is helpful just for everybody kind of making sure you decide who's going to kind of introduce everyone once you go in. That's the one important role. Who's going to say, we're all here from Family Voices, and we've come to talk about the budget. Another good job to assign in your pre-meeting is who's going to take notes. You want to very discreetly, but it's completely appropriate, to make notes about what they say, whoever the staff person is, in response to some specific question. And that's the third part. You want to have a couple of specific talking points, things you absolutely want to say very directly. We oppose these cuts. We want you to vote for a budget that includes revenues instead of just cutting health and human services. And those are the two most important things to say. If you just say we oppose these specific cuts, then what they do is they play us off against each other. So they tell the children's groups that they oppose cuts to kids, and they tell the senior groups that they oppose cuts to seniors, and they tell the environmental groups they oppose, and they tell us all that they're not going to cut our programs, but unless they raise revenues, they're going to have to cut somebody. And what we're saying is don't cut us. You need to raise revenue. And the other thing is then you want to have a couple of very direct questions. It's important to be really nice and friendly and polite because you're building a relationship. Ideally, this is something you do not just this summer, but maybe every quarter. You want to build a relationship between your organization and this staff person and this legislator. But you also have a right as a voter and as a community resident to ask them directly, so how does Assemblyman so-and-so view the idea of balancing the budget by making only cuts? Would Assemblyman so-and-so be open to the idea of raising some revenue to protect these vital services? I think the two most important questions are, would the Assemblyman be open to raising revenue to protect these vital services? And the second question, even if the answer to that first one is no, is would the Assemblyman be open to closing some of the tax loopholes that may not be achieving job creation in light of the severity of the budget deficit? You may find that people who say they're opposed to tax increases are having a more open ear to the idea of closing some of the tax loopholes just because otherwise the cuts are going to be so disastrous. So, okay, so that's your pre-meeting. So you've got your team leader, you've got your note taker, you've got your couple of points you've all agreed you're going to reinforce, and you've got your questions. And then you go in, and the receptionist smiles and says hello, and you say, hi, we're here from Family Voices or the Kern Family Resource Center, and we're here for a meeting with Joe Schmo. And Joe comes out, and you all go in the room, and then your facilitator just starts and says, you can be very businesslike. It doesn't need to take more than 15 minutes. The important thing is that you all come. You say, we're here from our organization, and we're all here because we're opposed to the budget cuts, to Health and Human Services, or to CCS or IHSS, and we wanted to share with you our concerns and hear what the Assemblyman is planning to do in the next couple of months. And then you each introduce yourselves. You give a very short, very, very short, 8 sentences, who you are, what why you're there, who's your child, what services do you use, and just tell the facts. Tell the facts. You don't have to give a lot of opinions. Just tell the facts about how the cuts could affect you. And then after everybody talked, then you can say to them, so would you share with us how the Assemblyman sees this budget problem and what he proposes to do about it. And that's when your person takes notes. And the nuances of how they answer, the words they use, are very important. So that's why you want to have a note taker. And then after you've had your meeting, after you've had a good exchange, you just thank them for sharing. Now there are things you can do to make it even more helpful. If you have a legislator who says, I agree with you 100%, say you're in Los Angeles and your assemblyman is, Speaker Perez, or the budget chair, Bob Blumenfield, or you're in San Diego and your legislator is Senator Ducheney. They are champions. They're going out there saying exactly this, and our message to them is thank you for your championship, right? What can we do to continue to be helpful to you? We have stories. If you'd like to do a press event with us talking about how important this is to families, we're there for you. That's a way you can offer to help them. But if you're in an office where a legislator either won't tell you how they think the budget should be fixed, or they say, it's really hard times, but we can't do anything that hurts corporations because they create jobs, and low-income people use more services, so of course we have to cut their programs. Then you're not going to be able to change their mind, but you can offer them facts. You can say, is there some way that we could share with you more information about the impact of these cuts on families in your community? We'd like to have you come visit our Family Resource Center. We'd like to have you come and do a home visit with some of the families whose children are using these programs so that you can really see. And remember, this may not be the legislator, but the staff, if they're proposing to cut your programs, they owe it to you to come visit your program, meet your families, visit your homes, see what you can do to keep a conversation alive and to educate them so that they really see firsthand what the cuts are going to do. And remember that the cuts are affecting you not only as a parent, but also as a worker. If you're trying to hold down a job and be a parent of a special needs kid, would cuts to IHSS mean that you'd have to quit your job? Would you have to get a second job? Would you have to institutionalize a child? There are things that you can say that make this connect with the concerns legislators have about jobs and the economy that may even be more effective than just talking about suffering. So after you leave, you want to do a quick debrief, a huddle, and bring everybody back together, kind of out of sight and out of earshot of the office. You don't want them to hear you talking about them. But what did everybody hear? Did you all hear the same thing? Did you get a commitment? Are they going to vote for a family recovery budget, or are they going to support any revenues, or do they think that we're going to have to do this with cuts only? And then share what you heard with Tara so she can share it with the Health and Human Services Network. We're all trying to share information after we do these ledge visits all around the state. As we hear what legislators are saying, our lobbyists in Sacramento can gauge, and we can gauge in the campaign, are people more open to this? What is the focus? What are they telling us about how long this is going to last, and what do we need to do to ramp this up? And I would say the last thing about visits is it doesn't matter whether you call, write, email, send postcards, or do an in-person visit. Those are all a way of contacting your legislator. The most important thing is that you do contact your legislators and that you work together with other people in your community to generate as many contacts as you can to your legislators with the same message. The message that the HHS network is using is we need to close corporate tax loopholes in order to protect health and human services. And we're doing that message because strategically we think that is the best way to talk about revenues, because the public is angry about the constant bailing out of corporations and the constant cutting of programs for kids and seniors and people with disabilities. They understand that, and it's a fairness issue, and they understand it. But of course, you all have to use a message that works, but you want to work together with other people locally to increase your power as a group by making sure that your message is the same and that there's a lot of it going into the same office for the next 2 months.
We have one hand from Terry. I'm going to try to call on you, Terry. Let's see if we can hear you. Terry, are you there? Terry? You might have to type in your question, so I don't think we can hear you. I have another question from Natalie. Natalie says, you mentioned the bill names earlier, but I couldn't catch them all. Could you please point out to the document that lists all of those bills you mentioned that are relevant to our causes?
Okay, I'll do that now. So I assume when I go online to different websites, everybody's seeing that. Is that right? Or not?
That's right. We can see it.
You can. Okay.
Yeah.
So this is the Health Access website, and our bills are on our healthcare reform page. And I think they're on both state reform and federal reform. But this first document called Fulfilling the Promise has a lot of bills that are all about implementing healthcare reform. The ones that I think are the highest priority and most relevant for children and youth with high healthcare needs are these ones about providing access for those with pre-existing conditions, the AB 2244 by Fewer. That one, the others are easier and are not being contested. AB 2244 is being lobbied against by the health insurance industry, so we do need calls on that one. And then going down the page, this regulating insurance company rates, AB 2578 by Jones requiring approval for rate hikes, and SB 1163 by Leno, sunshine on price gouging. Those are going to be the big fights where the insurance companies are really lobbying hard against them. And we would very much appreciate calls of support on both of those bills to the Assembly for the next 2 days. And then it'll be on the Senate side after if we can get out of the, well, so they're all in first house. So AB 2578 is in the Assembly for the next, until June 4th, and SB 1163 is in the Senate until June 4th. They each have to pass the House in which they originated, and then if they pass, then they swap over. So, yeah.
Okay, great. Thank you. That's helpful. Anybody else has questions? Let's see. Terry wrote in, I noticed the waiting period for pre-existing conditions is growing longer from 6 months to a year. Do you know if this is addressed?
What does she mean? The 6-month waiting period for kids or for adults?
I'm not sure. She didn't specify.
You're talking about the exclusion after they have to cover you, but they can exclude coverage of the condition itself.
Oh.
I'm sorry. I am not. I'm not completely certain if you're talking about. Presumably, you're talking about in one of the state implementation bills, because in federal reform, that's 6 months.
I'm not sure if it's federal or state.
I would, if you want to email me directly, if I can't answer it, I will find out and get back to you. Federal reform is a 6 month that after they have to offer coverage, but they can refuse to cover that condition for 6 months. I mean, there's no good policy reason for it. It was about how much the insurance companies were able to extract in concessions. They have incredible lobbying power. And the basis of their lobbying power is not just that they have a lot of money and lobbyists in Sacramento and in Washington. It's that they have this network of small business people in every legislative district in the country, people who sell insurance. And so they mobilize their base to go in and do what we're talking about. They're calling legislators, they're meeting with legislators, and what they say is, you know, this will cost money and it will disrupt the health insurance market, and the part of the message is, and we will make less in contributions to your campaign, you know, and they're on the Chamber of Commerce. And so part of it is about how active they are at the local level. So if they're talking about extending it to a year in the state legislation, I didn't see that. And our big fight will be to keep it from getting even weaker as we are trying to round up the votes. And unless we can mobilize people to go into legislators' offices in California and say, we need this bill to pass and we need it to have, you know, no more than a 6-month exclusion. I mean, I would be really happy to work with folks from Family Voices. If that's of interest, it would be something we'll be interested in. But bills can change between the way they're written when they're introduced and the way they finally pass. And unfortunately, if they're bills, consumer protection bills, they often get weaker.
I have one last question here from someone, and then I think we'll have to close because we're at time. But the question is, what's going on behind the scenes to move this agenda of closing corporate tax loopholes? Does it require a bill, a 2/3 vote? What's the timing?
Oh, I'm so glad somebody asked. That is such a great effort. It's been really fun to be involved in. Well, obviously, there's no big money behind it. The National AFL-CIO is certainly talking about it, and the State Labor Federation is talking about it. But a lot of this is very grassrootsy, and you know, we need all the help we can get. So there are some bills. The top one, so one of the organizations that's done really good work on this is a group called the California Tax Reform Association, and they're on the web at caltaxreform.org. And that's basically like one guy, Lenny Goldberg, who, you know, is a big lefty, and he is like an economist, and he does research on it, and he's got sort of the best research that people have. So we rely a lot on his data. The Legislative Analyst's Office has also been doing some good work, and if you look on the HHS Network website on the budget info, you'll see that the Legislative Analyst's Office just did, somewhere on here, they just did an analysis. Where is it? Well, LA's office has done analysis of potential tax increases, and they've actually recommended closing some of the corporate tax loopholes. There's a grassroots group called ACE, Alliance of Californians for Community Empowerment. They're organizing at the grassroots around the closing the Prop 13, the corporate property tax loophole, which Lenny Goldberg is also working on. That's the one where if Chase Bank buys a WAMU property, but they divide the sale between 3 shareholders and none of them get more than 33%, then it doesn't count as a sale, and the property doesn't get reassessed. So they're not actually paying the property tax on the real value of the property. The oil severance tax is getting a lot of traction in coastal areas, and Perez included that in his budget proposal. None of these can get a 2/3 vote. However, the budget negotiations do require, because in order to pass the budget, you have to have a 2/3 vote in California, and that means, because the reality is, and I think, you know, if you do visits to legislators, even though there's the official kind of line of the official Republican Party that they're against any form of tax increase and they won't do it, just like last year, they realized that you can't actually cut $20 billion out of the state budget without, like, shutting down the prison system or shutting down the UC system, or, you know, it really is stuff that nobody actually wants to do. So what's happening now is this kind of kabuki dance. So on the one side, the governor and the Republican Party say it has to be all cuts and no revenues. On the other side, you know, you have Speaker Paris and the Democrats saying it has to be no cuts and $10 billion in revenues. The truth will be somewhere in the middle. There will be a deal that will include some revenues. They have to, because it's Armageddon otherwise. And there will be 5 Republicans who end up agreeing to vote for that. And so the real argument is, whose taxes get increased? Is it going to be low-income and working-class families? You know, are they going to just basically increase income tax on, you know, ordinary folks, or is it going to be corporations and tax loopholes? And how much can we get them to do in revenues in order to minimize cuts? So no, you can't get 2/3 for these things, but in the negotiations, in the end, the parties must find some agreement, and there will be, I believe. But it won't happen unless we organize and push for it. And we can see the difference we're making in how the debate's being framed. I think you've probably seen it in local news and papers around the state. Closing corporate tax loopholes has gone from being a non-starter a couple months ago. It was not part of the conversation. Schwarzenegger said in January it was going to be all cuts. And right now, it's the LA Times is editorialized in favor of it. There's stories in the New York Times about a Republican mom in Menlo Park who was researching the corporate property tax loophole in her own community and how much money it was taking out of her schools. So if we work together, I absolutely believe that we can continue to push closing corporate tax loopholes to save health and human services, and that we can get a better budget in 2 months than we will get if we don't do anything.
Thank you. And thank you so much for joining us today, Jessica. This has been really informative and activating. And I wanted to say to everybody, as a follow-up, you'll receive a survey by email. Please fill out the survey. And if you're not on our listserv, go ahead and visit our website to sign up. Next month's webinar will be on Wednesday, July 7th at 12 p.m. with Juno Duenas and Mara McGrath presenting on healthcare connections. So I hope to see you all there. And thanks again, Jessica. This is really wonderful.
Thank you so much for having me. Please, anybody who wants to contact me, my email is on our website.
Great. Thank you. And thanks, everybody, for participating.
Thanks, Tara.
Bye.
Bye.